Hello, everyone. This is another Freedom to Feel conversation, and my guest today is Dr. Bestin Kuriakose. He is a physician at the New York Spine Institute. He specializes in minimally invasive procedures and innovative treatment modalities aimed at improving patient outcomes and quality of life. So, what's not to love about that? And I made that comment off record, improving people's quality of life. And to me, that's very important because everything is interconnected. I believe that life is this beautiful web. So if my husband is happy, my sister, then I'll be happier too. So it's this beautiful community of um, beings being well. So thank you for what you do, Bastin. So the full bio will be at the end. There's a lot more to you, so the file will be the bio will be at the end, and also at the end of this video and podcast notes. So a question that I love asking everyone from the get-go. This is my introduction to you, my brief introduction. But how would you introduce your own self? Who is Bastin in this very moment?
Sure. So, my name is Bestin Kuriakose, and who I am is, I guess, what I have grown up in terms of my family, my friends, and they have all shaped me to where I am today. And as a physician, this has given me the opportunity to help others, and specifically in my field of pain management and physical medicine rehabilitation, it has given me the opportunity to help others get back to what they love to do. And that's certainly been a very rewarding experience.
Yes, that's wonderful. I love the way you said that too, to go back to what we love to do, right? Because there's something about loving something and not being able to do it that creates more stress, right? And sadness, even depression for some people.
Exactly.
Yeah. So, what inspired you to become a physician?
Just from the beginning, upbringing, my mom was a nurse.
Yeah.
Her background in the medical field and coming back home with stories of how she was able
Yeah.
to help patients was certainly something that really brought my interest as a child. And then I had the opportunity to volunteer at different hospitals
Yeah.
in the community, and again, being exposed early and just the drive to help, wanting to help others is what led me to this field, and it has definitely been a rewarding experience.
Yes, right. And what a beautiful purpose to have. Is that something that you consider to be a purpose, the purpose of your life? You a calling, a mission? Is that?
I certainly do, because I feel like every day you come
Mm,
in to work not knowing exactly who you're
right,
going to be seeing as a patient, or what
right,
sort of personality, what sort
right.
of ailment, or what sort of
Huh,
pain that they are coming in with, and
true.
just that feeling of knowing that you are making a difference it has certainly been a rewarding experience for myself.
Yes, yeah. It very much relates to the concept of purpose. Yeah. It's something that makes us feel fulfilled and complete, doesn't it? It's for me has been that
Yeah,
feeling
yeah,
whole.
definitely. I think when you have a purpose, you have a love for it,
Yeah.
and that makes it a lot easier to carry out the duties expected of whether
Mm,
it's a job or whether it's
yes.
schooling, whatever it may be. That is interconnected in
Mm,
many ways, and it allows you to just keep moving forward. That's
mm.
where I feel like I am in life, and just and it's been a rewarding time for me, definitely.
Yes, that's really wonderful to hear. Really wonderful, especially in at the field, the area that you are, because there's a lot of stress. Like you said, we never know, or you never know what you'll face on that day. So it's having that sense of purpose and feeling happy about what you do. It just helps so much. It just passes. It's almost contagious. I don't like the word contagious, but it really is. It kind of transmits right to other people.
Correct. Yeah.
Is I'll be asking you lots of questions about so the topic is the text or technique. What can you do before it leads to chronic conditions?
Mhm.
So this is the topic of our conversation. But before that, is that do you apply holistic approach to this to the treatments, or it's specifically something that's more, let's say, specialized and focused?
So the body essentially is a unit, and I think that's the biggest thing. And especially when it comes to pain in the spine or the musculoskeletal system, I always believe a holistic approach is
Right.
the correct approach, because I always tell my patients not one thing will necessarily cure you or
Hmm.
fix you or relieve you of your pain, but
Yeah.
oftentimes it's a multifaceted or multimodal
Right.
approach to
Right.
deal with the discomfort, to deal with the pain.
Right.
And that's how I see it. And I feel like that's how patients usually tend to have the best outcomes with that approach.
Right. So you see that's to me that's wisdom, because yeah, the body's it's this gosh, again, it's another web. It's so complex, right? It's so many levels.
Exactly.
So, and then the interesting thing, Bastin, is that to get to the point of having chronic pain, that means there are so many things that had to have happened for this to to occur. That's how I feel. It's never just one thing. It's just like a series of factors. It really feels that way. Like in my own case, oh, I'll talk to you in a moment about about my neck pain, which has to do. There might be a problem with podcasters. I don't know. It's
Perfect.
right. The
I can
using
definitely yeah, the posture,
yes, right. Oh, so I can't wait to hear you what can we do to prevent, because I'm all about prevention. So, but before I we dive into it, I have another question for you, a warm up question. This is an open question about health. What do you feel is health is? What is a healthy person from your perspective? How would you describe that?
Yeah, so health is what allows us to be us as human beings. And a healthy person is a person that, and in many ways, you kind of touched on it before, low stress,
Yeah,
leading a happy life,
yeah,
being active,
yeah.
uh, being surrounded by loved ones, family, friends, and also just doing what you love to do. So it
Mm,
definitely has a physical component to it, which is very important, but
yeah,
also an emotional component to it as well. And
right.
just ensuring that both of them are at an equilibrium and working well with each other
Mm, yeah.
can lead to good health. Again, that also means
Mm.
following up with your doctor, making sure you follow up and get your yearly checkups, getting blood work, just to make sure everything is up to speed and in check.
Right. Yes. Thank you for saying that, for confirming that in a way. That's a
Yes.
confirmation. You just mentioned balanced. And the interesting thing, I had a question here for you that I thought before coming to this interview about balance. How do you see this concept of balance? Is that something that we can achieve? Is that a destination? Or do we always do we learn what balance is and we kind of bring us back to the state again over and over again? How do you see this idea of balance?
So yeah, again, the concept of balance of and just I think the biggest thing is understanding that oftentimes we have an end goal in
Right.
what we want to accomplish.
Yeah.
Certain days we might feel a little down compared to other days.
Right.
And just
Right.
being able to reach that balance, I think it's
Mm.
just multifactorial in many ways
Right.
of
Right.
for both an emotional and a physical standpoint. And that's where even coming from the body, physical exercise is
Yeah.
huge. It's very
Yeah.
important for the body, from
Yeah.
the musculoskeletal system, for the spine, from a
Right.
cardiovascular standpoint. That in conjunction with a happy life, low stress environment, it
Mm.
helps create that balance. So trying to achieve that balance every day might not be possible because we
Right.
have different stressors in life.
Yeah.
But if we come back to it as much as we can with an end goal in
Mm.
sight, I think that definitely allows us to move forward.
Yes, yeah, that's exactly how I feel. That it's almost like we need to know what balance is in order to have that knowledge, in order to return to it. So and keep that as almost as a goal, as you said. I love that. Yeah, balance, harmony as a goal, as some sort of a, let's say, dynamic destination, because it's never really static, right? It's always moving, like life itself.
Mhm.
So my last Gosh, I can't help it but ask you this question. My last warm up question is about success. How do you define success these days, Bestin?
So I think success, there isn't a true definition to success. I think the biggest thing is how you, at the end of the day, look at yourself and
Mm,
see where you are at, and if you
yeah,
feel happy with yourself. Because
yeah,
in today's society, with
yeah.
just
Mm,
like social media and different platforms, there's significant stress and there's
yes,
expectations that are expected of you.
right.
And that could also always be a hindrance in what you gauge as being
Mm,
successful.
yeah.
But at the end of the day,
Uh,
I think the biggest thing is you just reevaluate yourself and are you happy at where you are in life?
mm,
I think that's the biggest thing, and I think
mm,
that is success.
I love that. Yes, that's a beautiful way of kind of understanding and embracing the idea of success, like you defining success for yourself and being happy, right? That's a big one. I usually, for some reason, I use the word joy more than happiness. And I guess because joy has something to do with gratitude, being grateful and appreciative of life as it is, for being alive, even
Mhm.
when I can't find something to be grateful for, I still have this ground like, wait a minute, I'm alive. So this is amazing. And this is, it's a miracle to be here. So I always go back to that. And then that sense of happiness, joy kind of arises.
Mhm.
Do you feel the same way about these two concepts, joy and happiness, or they are one and the
Yeah,
same to you?
just life is important. A healthy well-being is also very important, and having that's probably the biggest success you can have.
Mm,
A healthy, loving life. I think that's definitely huge.
yeah, it definitely makes a huge difference to be healthy. It does. I was talking to my husband the other day about I had this pain in my neck. It was so bad that I couldn't move my neck. I woke up and I couldn't really move completely to one side. It was so painful. And then I said to him, it's hard to be happy when you're in pain, physical pain. It's so hard. I was still content with my life. And I'm very spiritual.
Mhm.
So I'm always very connected to, let's say, the universe, life, the divine. So that's easy for me to kind of not to ignore the body, but to kind of dance with it too. Just kind of let it
Yeah,
be what it is, the pain, and kind of inquire into it, of course, and ask questions and all. But it's not easy to be happy when we are in pain. That's for sure.
that's certainly true.
So let's talk about this issue. Gosh, it seems like we tried, as humans, we always trying to solve problems and then we create new ones. Isn't it the case with technology and
Yeah.
cell phones, the computer? Just now we have a new problem with this neck pain and all other kinds of pain. Like in my case, has been also my elbow. So and I feel like my thumb. So anyway, I use a lot this hand with my computer. So talk to me about the main issue. Like, what are we doing wrong? Could you stay in one place, the same motion over and over again? What is the main cause for the problem?
Yes. So like essentially especially when it comes to tech neck, back pain, I think the biggest thing is that it essentially is a lifestyle. It's a lifestyle that we all have knowingly or unknowingly become a
Yeah,
part of.
yeah,
Especially more so in the last decade or so, where there's
yes.
such bigger emphasis on devices such as this, where we're
Yeah,
constantly in a certain position, we're constantly putting stress over our shoulders, our neck,
yeah, yeah.
and that leads to the pain and the discomfort. And like I
Mm,
mentioned before, the body is functions as a unit. When we experience stress in one part of the body, in the neck, then you
uh,
start to feel some pain in your shoulders.
yeah,
Then you might start feeling pain in your elbows, and like you mentioned,
yeah,
you start feeling pain in your thumb.
yeah. Right.
So essentially, everything is connected to a point. So where when stress is placed in one area, it's very
Wow.
common for adjacent segments or adjacent joints to also start dealing with some
Right.
of that pain and that discomfort.
Gosh, yeah, that makes a lot of sense. It's very clear to me because everything's connected. But what is so that tension is because we are holding, are we staying in one position for too long based?
Yeah.
Is that the reason, the main reason?
So so the average human head weighs about 10 to 12 pounds. Okay.
Oh, that
So
much.
yeah, so we're supposed to be in a neutral,
Mm,
supported posture.
Right.
And essentially, when we're in a constant flexion with our neck bent
Mm.
forward,
Yeah.
that 10 to 12 pounds goes up significantly. It goes up
Right.
to like at essentially a 45-degree flexion. It can go up to
Ah.
about 50 pounds of stress being put on the neck.
Wow.
Now imagine having or holding something that's 50 pounds over your neck
Mm.
for more than
Mm.
5 minutes at a time. You start to feel your muscles are engaged, your shoulders are engaged,
Wow.
and it just leads to further stress in that area essentially.
That makes a lot of sense. I just thought about holding my head with my hand most of the time. Maybe I'll do that, which is not a good idea either, right? To try to hold your head still heavy that you want to hold it supported. Um, yes, I need to become more aware of that. Me and everybody else out there using the computer and the cell phones all the time. So the signs. So the next question about the signs. So that would be, it's not chronic pain, is it? Because in my case, it's almost becoming chronic, actually. It's interesting that we're having this conversation. So this is actually becoming a little chronic now because it's not, and I don't know if that's the reason really. I just kind of banged on the door the other day. So I was cleaning the house and I think, yeah, that probably made it worse.
Uh,
But yeah, what are the initial signs before it becomes chronic?
yeah, so usually the initial signs of text neck is you start to notice nagging pain in your neck. That it's like an aching pain that you start to notice. It feels a little uncomfortable for you.
Yeah.
You start to notice that your neck is kind of stiff. It's not able to move as much as it usually does. There's
Yeah.
some decreased mobility of the neck. You may notice some pain in the back of your shoulders also.
Yeah.
You may
Right.
notice you're not able to really
Oh,
have some discomfort.
yep.
Sometimes
Yep.
you might notice pain between your shoulder blades,
Mm,
in between
yep.
the shoulders. So those are
Yeah.
areas that commonly initially you start feeling some discomfort, some pain that may be in the setting of tech neck.
Gosh, yeah, that's exactly what's happening. So, in my case, because I lift weights, I work out a lot too with my husband. So, is that something that might make it? I thought it would make it better. It would kind of help me, but it could that could the lifting weights actually compound with the pain, the stress already? They'll make it worse.
So that's a good question. So usually the best thing, honestly, for tech neck is movement,
Right,
not staying stagnant. Like
right,
ensuring that you have good range of motion,
right,
ensuring that you're moving around. Those are all important things.
right,
Now, when you're working out, as long as you are working out, not just in an efficient manner, but also the proper manner with proper
right,
technique, and
right.
ensuring that you're not putting further stress on those neck muscles,
Yeah.
that's very important. And also, before you work out, I think it's very important
Mm,
that you stretch out the muscles before
right.
you work out.
Right. Yes, I do yoga, so that really helps.
Exactly.
Um, and so, besides exercise, movement, what else can we do to prevent this text neck and the tech neck problem?
Yeah, so a lot of it also kind of goes back to posture. Posture
Yeah.
ensuring that we have
Gosh.
good support. When we're sitting with good lumbar support. Our neck is not rounded, our shoulders are
Right.
not rounded.
Right.
Those are all important things to make sure that we are not engaging those muscles too long,
Yeah.
especially now in the time of like remote work, virtual learning. Um, Everyone's sitting. That sitting puts a lot of pressure on this both your neck and your lower back.
Mm,
So
mm,
ensuring that you're constantly getting up, not
yeah.
saying get up and exercise, but get up. Just
Right.
standing up relieves a lot of pressure off of your spine. So
Right.
setting a timer for every 15 to 20 minutes to make sure you're getting up, especially if you work a desk job.
Mm.
Those are very important things to keep in mind.
That makes a lot of sense. So posture. Yeah, I just made a note here. Posture, it's one of those things, those kind of a wisdom, almost like prompts that we only do it when somebody says it. It's like breathing. Can you just breathe deeper? And you
Exactly.
start breathing. Like you said, posture, I just kind of tried to change everything just for now. But then I go back to the habitual ways of moving the body. So habit is the main issue. So how do we become, what's the best way to become more aware that we are just kind of doing the same things over and over again without even our conscious awareness?
Yeah, so I think the biggest thing is knowing your environment. I think, for example, where you're working, if it's remote, you're working from home, maybe like a standing desk,
Yeah.
because
Yeah.
when you're just
Yeah.
relegated to just one sort of environment, you're just used to that. So
Right.
just trying to improvise a little bit. So like maybe if you do a podcast in the future, maybe you want to do it standing. A little
Mm,
different, you know? So
that's a good, yeah.
it's like things like this where you just want to change up that daily routine. You're
Yes.
not doing the same thing,
Mm,
and seeing if you could make some changes to it to see if that could help some of your pain and discomfort.
yes. I love that suggestion, right? I usually work when I'm working, my computer not doing the podcast. I'm always, yeah, sitting and then getting up, and I have the standing desk. I have everything. But then for the podcast, I don't have anything that, yeah, to support that position, standing position. So maybe I just thought about it now. Thank you for the suggestion, Besden. Yeah, lifting my computer. Yeah, that's a great idea. And I did interview somebody recently who was standing. He was a martial artist. He's a karate instructor.
Oh,
He was standing the whole time. I'm like,
amazing.
wow, that's a good example for all of us.
That is. He's engaged
Yes.
towards his muscle. That's important.
Yeah, I noticed that how he was like the posture was perfect. Um, yes, I guess. Well, I won't go deeper into my own ideas, but like because I'm very spiritual. To me, I get very distracted a lot of times with what I'm doing in the moment, and the body becomes almost like not a priority. Because when I'm working on things that I feel it could help myself and others and other humans, I've kind of forget about the self as the body in mind, the body especially. So maybe it's not a good idea to forget the body. We should all be reminded, right, to take the body with us in our spiritual journeys, even. Yes. So this problem affects most people. Would you say everyone in a sense, or mostly? I think you mentioned here teachers, dentists, drivers, podcast hosts, myself. But are there any other? What about teenagers? There are so many teenagers, right, and young people in
Yeah,
that
certainly.
case.
I think all age groups are susceptible to tech neck or
Right.
the after effects from it. It's just everyone may recover from it at a
Mm,
different pace. But when
right.
you are essentially um, going through that stress or engaging your muscles, even at a younger age, you might be able to recover quicker. But
Right.
over time, it becomes a chronic, repetitive strain in that area. The way
Right.
I think of it is like when
Right.
you go to the gym as a 16-year-old, you recover a
Hmm.
lot quicker than
Yes.
when you go to the gym for the first time in your 50s after not being in the gym for like 6 months. You might be
Yes.
sore for like a couple of days versus a
Yeah,
teenager will go back to that gym the next day if he needed to. Uh,
that's true.
so the same way with teenagers or even younger
True.
children, they're exposed to so much media, this iPad, cell phones,
Yeah.
TV. Uh, that posture definitely can have a cumulative effect for them over the long run.
So yeah, it takes time, right? It compounds, and then yeah, that becomes chronic pain. Wow, that's we don't want that to happen. So once we have that, that's the for some of us it is the case, chronic pain. What are the solutions that you offer at the New York Spine Institute?
So the biggest thing is coming and seeing a physician and being evaluated because
Yeah,
everyone has a unique story, everyone has a
right,
unique history to why they are presenting.
right.
So with that history taking, for example, myself, I would evaluate the
Yeah,
patient and see what their needs are. It may start off with just some physical therapy, some
yeah,
other conservative treatment modalities like acupuncture,
yeah,
osteopathic treatment, uh,
yeah,
chiropractic care. There might
yeah.
be some conservative measures that can be taken before we need to discuss like other medication management, injections,
Yeah.
before we get to that to see where they are and what their symptoms are. Essentially, that's the
Mm.
biggest thing.
Yes, I love the idea that so you'd also use alternative medicine like acupuncture. That's
So
a wonderful
it's
thing.
something I prefer. I don't do it personally,
Yeah, I like
but
that.
I am a believer of using multiple treatment modalities
Yeah,
in conjunction with, oftentimes in conjunction with one another to help patients. So that's it
yeah.
certainly has utility and importance in providing pain relief.
Yes, gosh, I love the idea that we can try everything that can be helpful, right? Not just one thing over the other. Be open and curious. That's wonderful. I heard about the injections. I do have somebody in my family who does that. She's very old. It's my husband's stepmother. So she's 80. She's in New York, actually. She's 80, 85 now. And she has been taking injections for a long time for her back and for her legs.
Mm-hmm.
But is that something that who determines that? It would be the physician or the patient when it comes to the
So
medical
at the end of the
interventions?
day, it's the patient's body, but
Yeah,
we as physicians just educate them on what we think would be beneficial for them.
right.
So it's in unison with one another, thinking what's the next step,
Yes.
and we talk about injections or interventions. It's a very broad term because
Yeah.
within that there's many different types of injections,
Mm,
types of interventions that these patients can
yeah.
undergo, and just coming up with a plan for you as a patient, I think is the most important thing, and everyone has a unique plan. So I
Yes.
think that's
That's
beautiful.
true. Do you also recommend supplements to help with the pain management with the pain?
I don't necessarily would prescribe or recommend specific supplements, but for patients, for example, if you're a little elderly,
Yeah.
osteoporosis or osteopenic,
Yeah.
essentially when your sorry, not your muscles, your bones are um, getting a little weaker
Yeah.
than usual. It's not
Yeah.
the normal arthritis, the wear and tear arthritis, but just intrinsically your bone is wearing down a bit.
Yeah.
Supplements such as vitamin D, calcium
Mm,
can be beneficial for
yeah.
patients, but not
Right.
necessarily for pain, I would say,
Yeah.
but for bone health.
Oh, I see. So prevention would also then require this type of practices in the sense of lifting weights that really helps with bones, right? With the movement and all that. That's something that I often do, but I noticed that doesn't really, it didn't stop the problem from happening. So I thought because of my yoga practice. I do meditation, breathing exercise, and I'm very aware
Mhm.
of the body. But this just happened all of the sudden, like this very sharp pain. So that tells me that it has been happening. This has been almost like accumulating, almost like it was already there and I was not able to be aware of. So it's very subtle too, right, Bez? And these what's happening within the body, sometimes we can't really tell and it just happens.
Yeah,
So
some things like, for example, we see patients that come in with under like circumstances of being in an injury or car accidents or other sorts of
yeah.
injuries, and then there's also just the natural wear and tear that just
Hmm.
occurs over time. And
Yes.
um, unfortunately, arthritis, you can't really reverse arthritis or
Yeah.
degeneration,
Wow.
but you can always prevent it from getting worse as much as you can. That's
Yeah.
where these different treatment modalities um, come into place. And
Yeah.
that can also include what you eat on a daily basis,
Mm.
ensuring
Yes. Diet.
limiting processed food,
Right.
reducing food that is high in
Yes.
inflammation. These are
Right.
all different approaches that can
Mm.
be taken for
Yeah.
overall well-being, essentially.
Yeah, that's so true. Yeah, I'm glad you mentioned that. Diet's so important. Yes.
Definitely.
When it comes to this, the tech neck problem, does it affect men more than women? Would you say, or we are equally affected by
Yeah, I
impacted
wouldn't
by it?
necessarily say I haven't come across any data where it's one gender is affected more than the other.
Right.
But then it also again it depends on different reasons of cause of their pain. Is the pain in the setting of work-related injuries or
Yeah.
things of that nature? But
Right.
I haven't necessarily seen a difference between men versus women. But then again, men also tend to have a higher BMI, body mass index.
Right.
So that
True.
extra weight can put further stress
Mm.
on
Mm.
the joints and the bones. So it definitely is a possibility.
Yes, it just came to me. Another thing that comes to mind is sleeping. I feel like when I sleep in the posture when sleeping, that's kind of funny. How do we become aware of the way we are sleeping? Because I can never know. So how do we? What's the best practice when it comes to avoiding these neck problems while
when you're
sleeping.
sleeping. Yeah, and
Yeah,
that's interesting you brought that up because a lot of the patients that I do see usually mention, "Oh, my pain started after a night of sleeping."
yeah, yeah,
The thing is, you
yeah.
can't take a history. What happened when you were sleeping?
Yes, right.
That's the great
Not it.
unknown because we don't know
Yeah,
how our body is positioned while sleeping. The
right.
biggest thing,
Mm,
though, is you always want to maintain the natural position of the spine, meaning
mm,
we
mm.
all have a small curve in our neck
Yeah,
area. It's called cervical lordosis. Uh,
yeah,
and then also in our lower back, we also have a small curve. And if you look at
right.
the mid back area, it's called kyphosis, so that the curve goes the opposite way. So what you
Yeah,
want to do when you're sleeping, if you're a back sleeper, you want to put a pillow underneath your knees. This
right.
alleviates a lot of pressure off your lower back. You want
Yeah,
to find a pillow that is appropriate for you, and it allows for the natural motion of the or sort of natural uh, function of the neck to stay in place. That's also very important. You
right,
sleep on your side, you want to sleep with a pillow in between your knees and kind of like in a cat
right.
position where you kind of flex your knees towards your chest.
Mm,
That also
mm,
relieves a lot of stress off of the lower back and the
right.
spine. So it's essentially finding ways to mitigate and minimize as much pressure off of the spine as possible.
Gosh, these are very good suggestions. I think I do have a pillow. My husband and I we have a small pillow to do exactly that. But I think my main problem is that I sleep on my stomach most of the time. So I think that's not the best way. You actually didn't mention that
Yeah,
just now.
stomach. The thing is, stomach sleepers tend
Yeah.
to. You can have pain because that kind of goes away from the natural contour of the spine. So if you do sleep on your stomach, try also putting a pillow underneath your stomach and see
Yeah.
if that helps some of your discomfort and pain.
I will. And I have it, but sometimes because you're right, it's not easy to kind of track, right? The sleeping habits because we are just not conscious. It's so not easy. And when we establish a habit, so hard to correct
Yeah,
it, especially the sleeping one.
yeah.
I'm trying to, but that's not an easy one. So let me see if I missed anything. Are there some tips? Is there anything else? What about for drivers? That's people I don't drive, but my husband drives a lot, and a lot of people that I know.
Mhm.
What is the best thing to do? Also, the pillows that would help them to
Yeah.
have that.
So that again, it's having just good lumbar support. So the interesting thing is that sitting actually puts significant pressure
Oh,
on your
you said
discs,
that.
on
Yeah,
your back. So you're
right.
essentially just loading your spine, especially when you're
Oh
sitting for a prolonged period of time. So
gosh.
especially if you go for
Yeah,
long drives, I would recommend frequent stops. That is very
right.
important. If you're driving with two hands, you got to find ways to switch it up because even that posture of just driving straight ahead, it's a form of
Yeah,
technique where you
right.
are just constantly holding that position for a prolonged period of time, with
Right.
discomfort and pain. And
Right.
you're driving, ensure that your head is not moving forward too much,
Yeah.
and ensuring that you maintain good posture. I think that's the biggest thing.
Yeah, so it goes back to posture, being aware of that and doing something about it. Gosh, this something that you see that again, it goes back to that breathing thing. When somebody say you need to breathe, you're not breathing. It's exactly when you said the posture thing. Then I started to just making all the adjustments, but just for the moment, and then we go back to the habitual ways of
Exactly.
using the body, which it doesn't help. So yes, so it goes back to movement. I see again and again and again. I have heard about, the flow, just circulation, always being in flow, always doing something, moving. Is that really the key for well-being, for physical health, and I mean physical health specifically?
Yeah, I mean, if you just look at an overall picture, I think it helps significantly because
Yeah.
staying stagnant, like you mentioned, just ensuring blood flow to the heart, to
Mm,
your
yeah.
joints, your muscles. Essentially, keeping active is is important, especially even from a cardiovascular health. Being
Yes.
able
Yeah.
to exercise daily is great for your heart, but also it's great for your bones. You know,
Right.
going back to quickly touching back on like osteoporosis, osteopenia, gentle weightlifting, weight bearing exercises are good for bone health. So even if you feel
Yeah.
like, oh, I'm too old or
Mm,
late in my life to start lifting weights, that's not true.
right.
Lifting weights does not mean you're lifting 40, 50 pounds at a time and doing bicep
Right.
curls, but a gentle
Yeah.
5 pound dumbbell can uh,
Right.
be beneficial for you.
Right. Yeah. Everything helps. Yeah. Just we don't have to go all the way bodybuilding. That's so true. And gosh, everything that you're saying makes so much sense, and it is something that's calling my attention now more than ever because I have been doing this for a long time, and now it's becoming all these pains showing up after 5 years. So it's interesting how resilient the body is, right? But it takes a long time to find. I'm 48. I'm not that young, but because of my active life, I think it helped. But I see now that's not just working out just for an hour or an hour and a half a day and then sitting for about 5 hours. It won't. There's no balance there, right? So that's not the idea.
Mhm.
We need to work out, but also move constantly, not holding one position for too long.
Correct.
That's what I'm getting from this conversation. Is that accurate? Am I
That is.
closer to it?
That is. Yeah, that's accurate. Exactly what you mentioned: moving, staying active, eating food that's healthy. You could work
Mm,
out for an hour and a half and then go grab food that isn't as
right.
healthy. So you're not reaching that balance. You're swaying one side or more to the other. You know.
Right.
So I think just a whole body approach. I think that's very important. Staying active, movement, anti-inflammatory foods, things like that are big.
Yes. I love that you brought that up again. It's holistic, right? It's not just one thing, the food, everything. Yes. And I do take supplements, omega-3, all those things for inflammation to prevent inflammation. So we're almost at the end. And I'm wondering if I left any questions unasked, but I'll ask you, is there anything that you left unsaid, anything that would be important to mention for this conversation?
Yeah, so like I think the biggest thing when it comes to tech neck, the everyone definitely does present in a unique way, and everyone is susceptible to it, regardless of age.
Right,
In your
right, right.
preteens, in your fourth, fifth decade of life, and the biggest thing is just being aware of your
Yeah.
symptoms. And
Mm,
I always tell early intervention is the best intervention.
true.
So don't let that nagging pain become a chronic pain. See what you could do,
Yeah.
kind of stop it while it's that nagging pain before it becomes that chronic pain.
Mm,
And just knowing the symptoms of when your symptoms are progressing, hey,
yeah.
it's time to see a doctor. It's time to see a spine or pain specialist to see what they
Yeah.
can do for me.
Right.
I think that's the biggest thing.
Right. So body awareness, prevention, and doing something about it when we see it's becoming chronic. Gosh, thank you so much for what you're doing. This purpose, this mission to educate people and help them in a practical way on how to do. And I know you work with, again, the New York Spine Institute. So the website is nyspine.com. It will be clickable here on the podcast, so you don't have to memorize it. But before we say goodbye for today, Based I have this question here for you. It's a little bit philosophical, but not exactly. I love spirituality and philosophy, but um, what three things you wish everyone to have or to do before they lose the body, before they die?
That's a great question. I think just working hard, being motivated, and determined.
Yeah,
I think those are
yeah.
three big things in life because it kind of serves a purpose in whatever you are doing. You know?
Mm,
Because when you're
yeah,
motivated, that means you
yeah.
you're pursuing something that you love to do. Working
Mm,
hard just shows that you're putting everything that you have in, and being dedicated
mm,
to something just shows the love and passion you have for something. And this goes across the board, not just for
mm,
work. It could be if it's preparing like a baby shower for a friend. Everything
yeah.
has a purpose for it. So
Mm.
I feel like those are three principles that I try to carry my life out with.
Yeah, it's beautiful. Yeah. Thank you so much for sharing that here. Yes. Yeah. And you mentioned that in the very beginning too, doing what we love. That's very important because that also translates into, I think, excellence too. There's something about when we love doing something, we do it better, right? And that matters. That makes a difference.
Mhm.
So thank you so much for being you. Thank you for saying yes to this conversation, and thank you for your contribution to well-being.
Great.
Thank you,
Thank you
Baston.
for
And
having
we'll talk soon. Bye for
me.
now.